And complex solid could be benign, malignant. Okay, and the rest of the things we're going to discuss during pathology. Okay, so those are the things you will express in your preliminary report, and you have to write your comment. But do not write the diagnosis. You in this country do not write the diagnosis, and you are describing the sonographic characteristics or feature on the preliminary report form, and the final report is given by radiologist. But they are taking your health. They have to depend on you, because in the real time, who is close to the patient? Who took the history from the patient? You. You are the operator. You are the sonographer. So you are very valuable person. Your competencies is very important. You are the priority. Okay? Make sure you feel like you are very important person in order to take care about the GYN imaging. Okay, so then you write down this preliminary report and you scan. Write your preliminary reports and scan. It will be saved in the server, and the doctor will retrieve it. Okay, when you are done, then go to the doctor, go to the radiologist. Okay, so next is present the case to the radiologist. Okay, then get the approval. Get the approval. Job done. Now you can let the patient go. This go means patient was in your room while you are in with the radiologist. Patient was in your room. Now you can ask patient, okay, now you can dress up, but make sure if patient cannot clean themselves, you have to help them. Okay, so then patient will get up, patient will be refreshed, and patient will say thank you, and patient will go home. Now come to this point. For transvaginal examination, you need to prepare the transducer. For transvaginal examination, prepare the transducer. But how does it look like, the transducer? So this is handle, this is shaft, and this is the head, and that has PZT. Okay, this is the shaft with the transducer that has a head, and that is a PZT, that is a crystal. It's a high frequency crystals. Prepare the transducer. This is an sterile transducer. Then you have to cover the transducer with the transducer covering. We call it prop covering. Before putting the prop cover, you have to put the gel over here. Okay? Then put the prop cover over it. Okay, so this is the prop cover. And now roll down the prop cover. Unroll, 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 and the prop cover will come up to here. Okay, so this is prop cover. This is gel. And now stretch so that there is no air in between the prop cover and the head of the transducer. That is the crystal. There is no air. And then tight with the shaft and put the ring, rubber ring or rubber band. So now it is tight with the shaft. So now this probe is ready to go inside. Patient can be overwhelmed. Oh my God, what is this? Is going to go inside? Okay. If this is the first time, patient will be nervous, but assure them it is nothing more than a big tampon. Okay, and patient usually doesn't get any bad feelings. If patient feels something discomfort, agnosis, pain, burning, you can take it off. If patient says, no, I don't want that, you can take it off. But make sure you explain it very nicely with the patient if it is the first time. If it is the second time, third time, so patient knows, oh, I know how we're going to feel it. Okay, so then put the gel on top of it. Again, now this gel is now acting as a lubrication. Then give it to the patient and ask patient, just insert it into your vagina. And patient knows where is the vaginal canal. It is in the patient's hand. Okay? You can do one thing, you can hold the hand, patient will touch here and patient will push it through the vagina. Once it is inside the vagina, is going inside, then in the monitor you can see it is in the vaginal canal. Then you can say, okay, now you got it. I got it. You can take off your hand. Tell them, okay, just I'm holding the handle. It is all covered. Nobody will see your private parts. You just insert into the canal and I will take care rest of them. Okay, and I did so many transvaginal examination, and it's so easy technique. Within 7 minutes, maximum 10 minutes, you can finish the whole protocol. Okay, so now when it is going inside, then look at the monitor, you see the structures can be seen, and you taking care, make sure you oriented nicely, sagittal and transverse. Sagittal and transverse. Good. So prepare the transducer nicely. If you need a chaperone, hey, I am male, patient was woman, I didn't do it without chaperone. Then who is chaperone? Chaperone is an eyewitness. It is a designated person from the hospital. They are in the room, so they are witness that nothing wrong happened. Okay? So then, once it is in the canal and touching the cervical external os, so then you will see the view of the uterus. View of the uterus. Turn into sas, then you will see the uterus. How does it look like? Okay, you will see the uterus like that, and you turn the transducer in transverse, then you will see the circle of the body of the uterus here. Now, patient is in this position. Okay, so this is anus, this space is perineum, this is vagina, this is urethra, this is clitoris, this is mons pubis, and these are the labia. Labia majora and minora. Just understand that uterus is here. The ovary is here in the pelvic cavity. Ovary is here. So this is uterus and these are the ovary. Ovary. This is right ovary and this is left ovary. The handle is inside. Okay, and the uterus, let me draw it here. Now I get more space. A small bladder is a transvaginal, okay? This is bladder, this is uterus, this is endometrium. So this is transducer. Okay, look, where is the transducer? This is external os, this is cervix, this is transducer head, head of transducer. Okay, and this is vaginal canal. So when the beam is going towards the uterus, beam will go like this. That means transducer is inside. So this is inside here. This is the head of the transducer. The transducer is sending the beam like this. More focus is on the uterus. More focus is on the uterus. More focus is on the uterus. And if you, so this is handle, okay, so this is transducer head. And think about, imagine, uterus is like this. This is fundus, this is body, and this is cervix. So if you scan like this, then automatically you can see the fundus, body, and cervix. Okay? So if you want to see the fundus, then you have to push the handle towards the anus. And if you want to see the cervix, you have to move the handle towards the mons pubis. Again, if you want to see the fundus and the body, you have to push the handle towards the anus. If you want to see the body and cervix, then you have to move up the handle toward the mons pubis. Okay? And now, if you want to see the right ovary, so then transducer head should be here. And handle would be there. And the beam is going this and this. You can cover, the color is not good, okay? What does that mean? This is right ovary. You need to see the right ovary. Look at the handle of the transducer. Where is it? This is patient's left side and this is patient's right side. The handle is to the left side in order to see the right ovary, and the same way handle for the left ovary see, this is the head of the transducer. Okay, actually the head is here. And it's sending the beam like this. Try to understand that. In order to see the left ovary, the handle should be on the right side. And this flexibility is always you have. You can move the transducer through the vagina towards the right side, towards the left side, to get the right ovary and the left ovary. So that type of flexibility it has. So transducer head is close to the organ and you can see the better view. And in order to see the transverse view of the fundus, body, cervix, you cannot see the vagina because transducer head is within the vagina. But if you pull down, then you can see the vagina. So then, in order to see the transverse view, you can do like this. Send the beam through the fundus, through the body, through the cervix, and that is the transverse view. And now in sagittal view, do like that. Then move to the right, move to the left, right is there. Move to the right, then handle will be like this. Then move to the left, this side, the handle will be like this. Okay, in that way you can see the uterus, ovaries very nicely. Very nicely. Ovary will pop up right away because you are very close to the ovary. Okay, so this is transverse view. So now let me write down. This is the transvaginal view actually. Not okay. Prepare the transducer. Okay, it is prepared. Explain thoroughly. The procedure. Understand that the patient understood you. Get a chaperone. Get a chaperone if you need it, because if you are male, get a chaperone. And number 5, instruct the patient about the feelings, okay, because patient can revoke the consent. And make sure take oral or written consent. Okay, make sure you do it. You will be free from anxiety. Okay, when it is done, all the images, save all images, and rest of the steps are same as transabdominal procedure. So then number 8, additional work is works are taking care of transducer. How are you going to taking care? So transducer is covered by the prop cover, right? So now we have to take out the transducer. Make sure it comes with the prop cover. Sometimes if you don't care, prop cover will remain inside the vagina. That's why I used to do, when it need to be grabbed, I grab the handle with the prop cover so that it comes easily. And as soon as you take it out, then hold the transducer in the left hand handle and this hand gloves, and take off the prop cover within here of your right hand that you have the gloves. Then take off the gloves. Now outside is going in and the prop cover is within the gloves. And now dispose it into the designated container. Okay? Let the patient on the bed, but give the towel or cleaning stuffs. Or if patient is able to walk, you can ask, okay, you can go to the bathroom and take care of yourself. And by the meantime, what are you going to do? You will take the transducer into the cleaning room. Then you will clean the transducer with the tissue paper. Then rinse with water. You can get gloves and